Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, I'm joined by Ben Hurst, CEO of HotDoc, good friend of Talking HealthTech, but been a bit of a stranger on the podcast feed for a while. Ben, great to have you back. How's it been?
It's been good. Yeah, sorry I haven't been next to the microphone for a little while, but very happy to be here.
No, looking forward to learning what you've been up to. In the depths of the feed, people can go back and I'm sure probably very early in the Talking HealthTech days, we caught up, and it's great to catch up in between things, out and about at events and things. But for those maybe unfamiliar and maybe more, the work you're doing in 2025 and beyond, tell us about you and HotDoc and where the priorities are now.
Cool. I'm Ben. I founded HotDoc 13 years ago. I used to practice medicine, and then I kind of saw the light and decided maybe that wasn't my thing, and starting a business was. From sort of the get-go, HotDoc was about helping doctors like my mum, who's a GP, focus on being great doctors and not having to worry about all the payroll, bureaucracy, accreditation-y stuff that takes them out of healthcare. And when I and the team wake up every day, that's the problem that we're trying to solve. And yeah, we're really excited by some of the cool stuff that we have for 2025 and beyond. I don't know if you want me to wax lyrical now, or if you want to sort of talk about certain things. But yeah, happy to chat.
No, that would be good because, it continues to evolve in this patient engagement piece and tying it in with how that looks for clinicians. Where's the focus as you kind of build out different tools and bits and pieces for HotDoc, and what are clinicians and patients asking for?
Yeah, cool. And right from the get-go, we always realized online bookings was the very tip of the iceberg starting point for everything that we do. And we've always kind of thought, all right, well, what are the things that practices do and doctors do, which is pretty manual and pretty annoying? And for me, that's what patient engagement is. It's saying, okay, recalls shouldn't be set by letters. Reminders shouldn't be a receptionist calling up every single patient in the appointment book. Checking in doesn't need to be a person coming up, interrupting the receptionist and being told to sit down. So that's kind of that's how we think. And we also think every time we can make the front office or the GP's workflow more efficient, that almost always has a corresponding benefit to the patient experience. It's much nicer to receive a recall, hit your device, and then to just look through, know that it's a secure pathway, and to make a booking directly from it. It's obviously a lot nicer to not have to wake up at 7:55 a.m., pray that you're going to get through to the receptionist to get one of the on the day bookings. That's what we think about. And the stuff that we're thinking about more recently is how do we help clinics sort through some of the not so fun, what's the best word to say? Compliance stuff.
One thing I think about, Ben, is that, the process of running a GP clinic is there's a lot of process and procedure, and yes, every clinic is different, but there's some pretty set things and activities that need to be done. And if I put my operations manager hat on, if everything remained the same, surely by now we would have really nailed what the process would look like for, a patient going through the flow of seeing a GP clinic, or even for a clinician's point of view in doing a consult. There's so many consults that happen every year around Australia, but I think about my own healthcare experiences, and I'm still doing that thing where I'm, waking up 5 minutes before a clinic opens just so I can be the first to call, because the clinic isn't utilizing any tools for one reason or another. Or more commonly, there's a lot of clinics that are using tools like HotDoc that could be improving efficiency and everything, but then systems change, or there's new regulatory requirements, or the way that things are funded are different. So it feels like I imagine it would be hard from a clinic owner's point of view, in that you're kind of building out you want to build a machine that allows, things to be as efficient as possible so you can be the best clinician you can. Yeah. But then if the goalposts keep moving, or if then you've got a requirement, otherwise you can't operate, that changes. And then you burn an extra hour for one patient to make 5 phone calls because the thing didn't work, and you do that a couple of times a day, that then just throws everything out the window.
It's really tough. And my experience in the last 13 years is that there's a big change just about every year that medical centers have to sort of lean into.
Yeah.
Last year, it was probably a bit more on the payroll side. This year, it's a little bit more on the MyMedicare assignment of benefit side. And for all the good intentions of the Department of Health, like ultimately they're putting like a huge administrative burden on top of clinics where they have to kind of overlay processes on top of processes. And to the best of our ability, we try and say, okay, well, how do we help clinics through that? How do we give them good information to help them understand what they need to do? And how do we also just like automate as much as we reasonably can so that they're not having to ask every single patient who comes through the door or who is checking out, do you agree to be bulk billed if that's indeed what they want to do for that patient? Equally, they don't have to talk to every single patient and explain what MyMedicare is and what the onboarding process is to get them to become an enrolled patient. Like, that's going to be possible. There's no practice in the world who can just do that for every single patient all the time. So that's sort of like what we try our best to do, is to sort of handle these changes that happen and streamline them as much as possible for the medical centers that use us.
That's going to be important too, because I think about the broader landscape, and another big issue facing a lot of GP clinics today, depending on where they are, is I guess competition with alternatives. And back in the day, we used to talk a lot about GPs versus pharmacists, and I don't think that's the major kind of conversation, but that's a conversation for another day. And it's not versus, just to clarify, so I don't get angry emails. But the these days
there's a Venn diagram with a little bit of overlap.
Yeah. Like,
naturally, there's a bit of
lots
a
of them are friends. But now it's and sorry, just for context for that, it's from a patient's point of view, if I was to, as a patient, I don't really care about the operations, the business of a GP clinic. That's not my priority. In the end, I've got stuff to do and I need this thing to be addressed. And if it's just easier for me to, back in the day, walk into a pharmacy and say, what do I need? And they can kind of do some things and away I go. That's way better than if I was caught up at a GP clinic that was inefficient and it took longer for me. And maybe I feel like I didn't get as cared for and all of that. These days, it feels like the alternative to going into a GP clinic is to do a virtual consult with, say, a virtual only provider. It could be on an app. It could be asynchronously. So it's not even in real time on a video. There's all these other ways that just feel convenient. So I guess it almost feels like, if the in-person services that are provided in a GP clinic feel cumbersome or a pain, then why wouldn't I just do a more efficient thing that allow me to get back to, so I can go on this holiday or go back to work on Monday or whatever the things I need to do as a patient. So this world where, there's more patients, I'm guessing, looking at going to virtual only providers, I imagine that plays a part in your thinking too?
Yeah, it does. I guess given the history of HotDoc and having a mum who's a GP and lots of friends who are GPs, like HotDoc's just naturally always going to align a little bit more closely with sort of GP brick and mortar customers than we might with sort of other participants in the healthcare system. And that's why when perhaps 2.5 years ago, we noticed that a large number of patients, when they were reaching the appointment booking screen, were dropping off. We tried to understand what's happening and what can we do about it. And what we realized is that a lot of the really like the busy and often very good doctors are not able to provide the sort of availability and convenience that their patients were looking for. And that was leading to patients considering clinics down the road or some of the other options that you mentioned, such as pharmacies, virtual only providers. And so the first thing we did about that was like, well, what's a way that we can maybe streamline some of the healthcare delivery that they do so that their patients can get a more convenient service and appropriately remunerate the doctor who's providing it. And that at the initial inception was quick consults, just an asynchronous way to request a repeat script, referral, or some other basic services to your existing GP or a GP at that clinic. And without having to sort of, you could completely bypass the appointment book and get that service for, between say $25 and $35. And we did that. And it was like, it's got very good take up, but we still noticed that it was a challenge. A lot of patients around Australia, they are trying to book with their regular doctor if they have one, but it can be a challenge. And depending on the clinic, depending on the doctor, you can wait a week, you can even wait a couple of months to be able to see your GP. So that's sort of one of the things that we thought about was, all right, well, a lot of patients are now leaking out of the brick and mortar system into that virtual care environment. How do we help our customers provide a service that is going to provide a valuable safety net when a patient can't reasonably get a service for something that they really do need in a couple of days, or even minutes. I myself, an asthmatic, I run out of my medication all the time because I'm vague and silly and I forget to go to my doctor and get the refill and so on. And it's just like, it's really hard. Like if I go a couple of days without my medication, I have a pretty significant cough and it means that I can't exercise. And so lots of people like me are in that predicament. And what we think is a really good way to help patients be able to access high quality services when they can't reasonably see their regular doctor, or if they don't already have one, is by a service that we built called Telehealth on Demand, which means that patients can get access within minutes, not hours, with a high quality medical service, and in a way where the information from that episode of care can go back to the regular doctor. So that's something that and for some patients, seeing the pharmacist is an appropriate choice. For some patients, seeing a virtual provider is their only choice. I think for most patients, as much as possible, seeing a regular doctor, but it's not always possible. And so that's how we're trying to sort of add value to the system and improve accessibility for all patients.
Yeah, there's something in that whole patients are going to explore options and they'll want choice. That tie back to your regular GP, I think, is always going to be important. So it's, good to hear that's front of mind. The other challenge too is that, it's not that we're just competing with, be it patient expectations or requirements of, being able to access care whenever and however they like, but also we're going to get to a point where we don't have enough GPs to actually do the GPing. I've not done the maths to project it out, but I do hear that it's not a sustainable model if we keep doing what we're doing.
It's tricky. Like the burden of chronic disease, aging population, and the fact that 1 in 5 doctors are planning to leave. Actually, I think it's 1 in 3 doctors are planning to leave the profession in 5 years. It suggests that there is going to be a significant shortfall. And I think the RACGP have estimated that by 2030, there'll be a shortfall of 5,000 doctors if things continue as they are. So I think all ways that can help medical centers run more efficiently and sustainably, as well as help GPs run more efficient and sustainably, are really positive methods of increasing that capacity. We know across our database that at any one time there are 400 doctors not seeing a patient. So part of what we're thinking about is, well, how do we help doctors? How do we help the doctors who aren't doing anything at that time have the ability to see patients to sort of improve the capacity of the overall system? I think there are lots of other great ways where doctors can, instead of doing 1 to 2 hours of admin every day or every week, they can instead be seeing patients, and that also increases the capacity. We can also train more doctors, and we can try and get more doctors from overseas to come to Australia. But those in and of themselves are probably not going to solve the entire problem.
This reminded me of a not fully formed thought, but let's see where it goes, because sometimes these work well, other times they flop. But I was, I often think about this, maximizing my time and being as efficient as I can in, running my business of Talking HealthTech. And I was walking down George Street and I'm like, I've got a good 15 minutes walk to get from this thing down to this event. And my mind immediately goes to, well, what can I I do while I'm walking to be more efficient in this process? And cognitively, I'm like, I have no capacity to do anything effective. And I kind of had this realization moment too, where it's like, it's not necessarily about filling every single gap of time with doing something, because whatever I did whilst walking, be it like doing a voice memo or checking my emails, and all, probably wouldn't have been overly effective. And if anything, I just carved out 15 minutes, the next morning to smash out those tasks, I'd do that more effectively. But I feel like there's something in that too, in what you said, where, if there is that downtime, yes, GPs may not be seeing patients, they're probably doing something else, or goodness me, maybe they're getting a coffee or something, or like trying to just do something in between. But if we can, in that time in which they're choosing to work, we can make sure the work they're doing is most effective. And sometimes for some GPs, it could be doing a period of time where they're doing virtual consults or asynchronous things, where they're actually able to see in inverted commas more patients or care for more people, and in the end they have more effect. So I guess it depends on who you are and what you do and how you work, but having that flexibility and options are going to be pretty important.
Yeah, I think that's it. I think that flexibility is a really important thing, and flexibility can mean a lot of things. Flexibility can mean the ability for a doctor to work at home and still be able to put in a good shift, even though they also have to look after their kids in the background. Like that is flexibility. Flexibility is also not forcing patients to attend in-person 15-minute consultations when they literally don't need that level of inconvenience, both for the patient and the doctor. A repeat script doesn't take 15 minutes, and it doesn't deserve driving 10, 15 minutes, finding a car park, etc. So I think for me, that word flexibility is a really important one. And I also think part of the reason that doctors do have a really significant level of burnout is because the way they practice lacks flexibility. It's kind of very tied into the Medicare model, the traditional in-person appointment model, and helping practitioners practice on their own terms with more flexible approaches is a way I think we can sort of help reduce that level of burnout, and most importantly, make general practice like the fun, awesome profession that it deserves to be.
One other benefit, I guess, of the when options are opened up to do a virtual consult or engage with a patient more than what you do in just the consultation, is the capture of information. And sometimes that can be overlooked in terms of the value of that. There's the pre-consult surveys, or the information afterwards, or the things in between. All of that data hopefully then can, as long as it's managed in the right way and presented in an effective way, because the last thing we want to do is just collect a buttload more data and then just make it like a mess of information. And the first thing I would do as a GP is look at the screen, see a lot of text there, and be like, no worries, turn my screen away and say, like, how can I help you? Well, let's start from the beginning. And then from a patient side, it's like, oh man, like I just told people this, or we talked about this 6 months ago. And for that GP, they saw hundreds or thousands of patients in between, and they do their best. But there's something about this, if we're engaging with people virtually, we're going to be capturing more, even asynchronously, or sending them surveys, we're going to be capturing more information. And then it's like, well, what do we do with that so we can serve it up to be efficient?
Totally. It's a tricky one. Like we've looked at sort of the pre-triage information capture, and there's some doctors that really liked it. It just helps them like go straight to the heart of the matter. Like, why is this patient attending? What do they most want to talk to? Other doctors didn't like the idea that potentially you can get information ahead of time, and that might create some sort of level of medico-legal risk. And other doctors altogether were really interested in, they had their model of care was a really personal one. And if by getting the patient to already answer that question of why have you come in today, that changed their flow. And so I agree with everything you said, Peter, but it also just suggests that sometimes something intuitive it's not always easy to just like turn into to commercialize, and equally it can be, sometimes you just got to figure, like every single GP is different.
Yes.
And I think that's the big challenge. That's why there's never any silver bullet. So I think there are some really, to maybe just like riff on the point you made, like that, pre-triage is one example. I think that has its own value, but you just have to understand the differences in how practitioners practice. Something that we think about a lot is there are a lot of patients who they're genuinely looking for a certain type of provider. It might be a specialist. It might just be a subspecialty provider. And something that HotDoc doesn't do very well today is capture that patient's intent. What sort of, not just are they looking for a GP in their location, but do they have a specific problem, condition, or a procedure that they want to undertake? And are they trying to sort of connect with the best possible provider for their needs? And right now, if you're a patient, it's really hard to know for that thing that they want addressed, who's the best. And so the GPs are just the obvious catchment, like help me know where to go to next. But sometimes even the GPs, they don't know the best possible person, especially if it's a very niche problem, right? The best possible provider for perimenopause, the best possible provider for irritable bowel disease, who provides non-medicinal approaches. Like those are challenging things. And so I think that ability to capture information at the right time and use it in a way that's really helpful and is also more efficient is a really important thing. And I think that companies like HotDoc can probably do a better job of capturing some of that, at least intent, earlier in the process of the patient journey.
Made me think then, I guess, in lieu of that, and I don't know who does that really well, to be fair. I mean, if we can crack that as an industry, that's great. Because in lieu of feeling like, if I was a patient and I didn't feel like that intent is addressed, the places I'm going to go to have that addressed is places that I trust, and a lot of people trust platforms that are outside of the healthcare system that could be great or could be not great, be it online social media groups and all of that. And all of them have a really good role to play, but it can be the Wild West. So I think if there's a role to play there for technology to bring that back into the system in a trusted and scalable way, that's got to be a good thing.
100%. And something I know about GPs is they don't always just want to see whatever comes through the door. A lot of GPs, they have their own subspecializations. There are some areas that they're really passionate about, and they know to the level of even a specialist. And so if we can help patients make more informed choices about what kinds of services that they want and what's the sort of the thing that they're trying to solve, and connect them to GPs and other health professionals who are really passionate and have demonstrated that they're really great at providing positive patient experiences for those appointment types, then I think HotDoc is doing its little bit to help with the challenges around accessibility and healthcare matching.
Mm. Hey, Ben, even in this conversation, you've reminded me that one thing I love talking to you is that it's probably a culture that you've instilled through the business, but you obsess over, what people think about something, and your people are, clinics and doctors and GPs and stuff. And so often, we'll see insights that HotDoc have obtained and then sharing that with others. And, you've mentioned a couple of times, this is what we're hearing from clinics, what they want, and you'll implement something and then listen and then pivot and do all of that, which is great. What else are you seeing, from GP? What are you hearing from outpatient GP clinics 2025? What do healthcare providers want, and how's that informing what you're building moving forward?
Healthcare providers, at least across the surveys that we've done, which are very focused on our customer base, they're really looking at ways to just automate the nonsense or the not fun stuff. And we spoke about some of the compliancy challenges before. They're also looking at ways to provide differentiated patient experiences. I think some clinics who are really wanting to stand their ground and provide mixed billing services, there is significant competition between different clinics, and they realize that it's not just enough to be a GP. They need to show that they have abilities and different sorts of providers who provide different sorts of services, and they want to be found for those sorts of services. They might have skin checks, they might provide certain menopause services, etc. And that's something like we're seeing that extra sub-specialisation in the industry. Probably the last thing that we're seeing is more clinics want to be able to provide, they already provide often really good in-person experiences for patients, but telehealth is something that they're still improving on. They might not have the infrastructure, they might not be able to do video, they might not be able to collect payments for those sorts of services. It's always super easy to be found by patients outside their immediate catchment zone. And I think they realize that a lot of the GPs who are working for them do want those more flexible arrangements where they can provide that in-person care as well as the virtual health care. So something that we're pushing pretty hard is this model of hybrid care, the ability for clinics, brick and mortar clinics, to provide great in-person experiences as well as great telehealth experiences for their patient base.
Yeah, love it. Ben, it's always good to have a chat and just catch up on where the priorities are, what you're seeing, and that's helpful across the ecosystem. So appreciate you making the time for this. We'll make sure the details are in the show notes of the episode for people to check out, and HotDoc's got a listing on our website people can have a look at. So I'm sure I'll see you out and about at something, Ben, and have a chat again on the podcast soon. Thanks so much for joining.
Thanks, Peter. Appreciate it.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.